Yeah, so we were motivated by the disparities that we know exist between Black and white men with prostate cancer. We know that Black men are more than twice as likely to die from prostate cancer than white men. And so we just wanted to explore these disparities in the context of precision medicine for men with metastatic castration-resistant prostate cancer. What we found, so we looked at two things. We used data from the PROMISE Consortium, which is a collaboration looking at clinical and genomic data for men with prostate cancer. And we compared two things. Number one, we were looking at the rates of actionable alterations between Black and white men. And so what we found there is we found that Black men, at least in our cohort, were a bit more likely to have mismatch repair deficiency, and they were less likely to have PTEN alterations. So we did see some differences in the genomic data that, from the Black and white men. In addition, what we found is we wanted to see what happened with that information. So with respect to treatment, we were asking whether there were different rates of prescribing targeted therapy for these biomarker-directed therapies. What we found was that Black men were actually less likely to be prescribed targeted therapy than white men. So I think that's pretty important because it really points to something that we as an oncology community can do to reduce these disparities.